Welcome, everyone. Good morning, good evening, depending on where you are connected. We will allow some minutes for everyone to join this conversation, and we will get started. Welcome, everyone. Good morning, good evening, depending on where you are. Hope you're doing okay, that you have started the year well with a lot of work, I imagine. Good morning, good evening. Good evening to you, I think.
Yeah, good evening.
Yeah, good evening, good evening. Thanks for being here. We know that it's sometimes hard, like working with a lot of time zones. It's hard because we have crazy times for our calls and our meetings, but we hope to make this hour and a half that we will have together engaging, and that we can exchange some great information with other advocates and colleagues from around the world. So Nadia, I wait for your thumbs up to start, since I don't have the list of the people registered for today. But
I think we have almost everyone here, so I think we can start. Thanks so much, and welcome everyone.
Thanks, thank you, Nadia. Okay, so good evening and good morning to everyone. We are here today to have this conversation about front of package labeling, front of package warning labeling more specifically. And we are having colleagues from India and also from the Philippines, since in both countries, in India, it already started this campaign a few years back, and in the Philippines, the campaign is starting. So we hope to have like an engaging conversation. We have colleagues from many countries in Latin America who will share the great experience and all the lessons learned in those countries that have passed and implemented successfully FOPL, of course, still with a lot of obstacles, as they will share with you, but we hope to have an engaging conversation. So I will provide some housekeeping rules just before we start, since this is like in a meeting mode and not in a webinar, because we want it to be engaging. We want to hear everyone's ideas. So be sure you're on mute when you are not speaking. Use the raise hand button when you want to speak up, and mainly for the debate and the conversation that we will have after the presentations. As soon as you're hearing all the presentations, feel free to write down your questions or to put them in the chat so we can address them at the end. And of course, if you're comfortable, if you're keen, just turn your camera on so we can see each other's faces and feel close to one another. Next one, please, Niola. Great. So as I know that most of the people here knows about the incubator, but since we are organizing the space, we wanted to remind you that we are an organization that we support other civil society organizations around the world who advocate for public health policies that reduce death and disease. And specifically today, of course, FOPL is closely related with the work that we do at our food and nutrition portfolio, which entails the cardiovascular health program and the food policy program. So this is the framing that we wanted to provide today. And next slide. today we will hear from the agenda first, sorry. So first of all, we will hear from Vandana, who is one of the vice presidents of the Incubator, who will provide some opening remarks. Then we will hear from Nadia, who will share with us kind of the evidence supporting front of package labeling policies. We know that we all know a little bit about this, but it's always good to set the ground for the conversation that will go next. And we will hear from the experiences around the world about the progress of front of package warning labeling policies around the world. We will hear from India because we want all the panelists and the participants to know how the process of India has been so far, so we can see and explore together how we can support this process. And we will hear from the experiences of Argentina, Mexico, and Colombia. And then we will have some time to exchange ideas, to answer some questions, and have a more open conversation. So now it comes the next slide with all the panelists today. So we will have Luciana Castronova from FIC Argentina, and she's the project director of the food policy program. We will also have Rebecca, who is the institutional development director of El Poder del Consumidor in Mexico. We also have Milena Gualdrón Ribeiro, who is a nutrition researcher in FIAN Colombia. We will also have Sanjay, who is a lead consultant for GHAI in India. I think everyone met Nadia because she was organizing this space, who is an associate director of research at the Incubator as well. And I am a lawyer. I'm based in Argentina, and I provide support also for the food and nutrition portfolio at GHAI. So I think with that, I don't know if anyone has any preliminary questions or we are good to go. Great. So before diving into the Nadia's presentation, we would like to hear from Vandana. And Vandana, I know you will provide some quick opening remarks for everyone to hear. So thanks everyone for being here.
Thank you so much, Luhi. And I want to really thank Nadia, who sort of, as she has sort of joined, our core team as in India, for giving us this idea of, inspiring our colleagues from India who have been hard at work, as well as our team from Philippines. So I wanted to just, share that, a lot of the best examples of FOPL come from Latin America. So 4 years ago, the India team began the campaign, and you will hear a little bit more from Sanjay about this. But this is, a really hard-fought battle. We've been at it, with sort of a very pretty large team of civil society advocates, researchers, experts in India. And I want to say that we've been constantly, innovating, because in some ways, many of us who worked in tobacco before that are used to dealing with a really tough industry. But I don't think we could estimate sort of the strength of the food industry and sort of how they've been working closely with the government, often against the goals of public health. So I think in some ways, we've had some successes, but also many setbacks. And I think what India does, obviously is going to be very important for the rest of the world, because it will, it's going to be one of the first examples in Asia, but also being, now the largest country in the world, will have like huge public health impact. So I think as we were brainstorming the beginning of the year to really see how we could sort of set the stage, because as India goes into a big election, like a lot of other countries, we're expecting in the second half of this year, we are going to see, potentially, policy being announced by the government. So we wanted to inspire, the civil society advocates, as well as our own team, with some very exciting examples that have emerged from Latin America. So, I'm so happy that we've been able to get some of our colleagues from Argentina, Mexico, and Colombia to come and share not just the success, because a lot of times you celebrate the success, but, the journey to reaching that success, the ups and downs, the challenges, the strategies employed, sometimes the defeat. So I think for us, as we are constantly, as our team, we sort of every 3 months over the last 4 years, we've kind of had to kind of reinvent our campaign, look at new strategy, legal options, political options. So I think for us to really hear from our colleagues about sort of the ways in which they dealt with industry pressure, with, sometimes government completely being on the other side. I think we're looking to be inspired, and also to inspire. The India journey is also incredible. And I know the team from Philippines is just beginning this journey. So I think the whole idea is that between sort of India and the Latin America examples, we can sort of share and sort of come up with new ways in which we can sort of take this journey and move this forward. So I myself am looking really forward. I am glad, as I think Luhi said, it's great to see we have nearly, over 25 people here this morning, evening, afternoon. Always hard when we do these global webinars. It's never an ideal time for anyone, but so glad to see everyone here. And hopefully we will have more successes and inspirational stories coming out in this year in 2024. So I'm not going to waste too much time, but I just want to thank sort of Nadia, Luhi, and the entire sort of GHAI food and nutrition team, but also especially our inspiring colleagues from the 3 countries. So thank you so much, and I turn it back to you, Luhi.
Thank you so much, Vandana. So yeah, it is great to see, and we have a lot of flexible people because everyone adapts to any time. Like last month, Luciana from FIG, she was in a super late meeting with the Philippines, and it's always like that. So yeah, I'll turn it back to you, Nadia, so we can move forward with the presentation. Thanks.
Thank you so much. So again, good morning, and here and good evening to our colleagues from India. So thanks for the kind introduction and the kind words, Vandana. In this presentation, I'll be covering evidence around front-of-pack labeling systems. Next, please. So let's start. So front-of-pack labeling has been recognized by public health organizations as a cost-effective policy to promote healthy diets. The purpose of this policy is to identify products that are in excess of nutrient of public health concerns, such as sodium, sugars, and saturated fat that have been linked with non-communicable diseases. Next, please. So this figure illustrates the pathways through which policies influence consumption of products carrying nutrients to limits, such as the ones that I mentioned, sodium, sugar, and saturated fats. So the purpose of a front-of-pack labeling system is to provide consumers with clear and easy to understand nutritional information on packaged foods, and to indirectly motivate the food industry to reformulate food products. This in turn will help consumers in making healthier choices, which has an impact on diet quality and ultimately resulting in health improvements and potential healthcare cost savings. Next, please. So there's increasing international momentum for front-of-pack labeling policies, as we know, as a regulatory initiative to address the global burden of non-communicable diseases. As you can see in this map, these policies have been implemented around the world in either a voluntary or mandatory basis. Next, please. Okay, so this table shows some examples of different front-of-pack labeling systems of schemes. In recent years, nutrition labeling has evolved, moving from just informational labeling to interpretive labels. So these are classified as informative labels, displaying information only, or interpretive labels, which provide judgments on a set of nutrients. So there is large support for interpretive front-of-pack labeling from many public health organizations, agreeing that interpretive front-of-pack labels are easiest to understand and most useful in consumers' comprehension. Next, please. So the evidence demonstrates that mandatory measures are more effective than voluntary ones. When adopting a voluntary labeling system, food companies often use the guideline daily amount or GDA system. So evidence evaluating the effectiveness of voluntary measures shows poor implementation, and we're going to see an example. Next, please. For instance, initial evaluations of countries adopting mandatory GHAI or excess front-of-pack labeling approach show a decrease in the proportion of foods and beverages displaying front-of-pack labeling symbols following implementation. So here's an example from Chile, where after a year of implementation, the proportion of products displaying any warning label decreased from 51% to 44%. And this is just during the phase 1 of the policy. In contrast, Evaluations of the voluntary health star rating system implemented in Australia and New Zealand in 2014 found low levels of label adoption. So for instance, in New Zealand, only 23% of products had the label, in Australia, 31%. It's also worth noting that the products that are labeled are more likely to be healthier alternatives that will be rated between 4 or 5 stars. So therefore, more countries are favoring mandatory approaches. Next, please. Okay, so regarding the design of labels, overall evidence has shown that warning labels are more effective at improving consumers' understanding of excess nutrient content than other systems such as the traffic light label system. Also, warning labels can be located more quickly. It is easier to read the label when the most contrasting colors are used. So for instance, in the black octagons, we have very distinct colors, black and white. And the psychology of colors demonstrates that using multiple colors on the packaging of labels increases consumers' appetite for the product and stimulates more emotional rather than rational decision-making. Next, please. Also, just quickly, I want to mention that meta-analysis, and this is one of them, shows the warning labels may be most effective in influencing purchasing behaviors of consumers. So far, we've talked about studies and evidence that support the implementation of front-of-pack labeling systems. So what do we know from initial evaluations? Next, please. For instance, in Chile, evaluations of phase 1 of the policy shows a decrease in purchasing of high-label beverages by 24% compared to expected purchases based on pre-front-of-pack labeling trends. Another study examined changes in the calorie, sugar, sodium, and saturated fat content of food and beverage purchases after, this is only evidence from the first phase, right? So after the implementation of the first phase of this set of policies. And results show significant declines in these targeted nutrients. So these estimations might capture not only the front-of-pack labeling, but also the marketing in a school-based restriction and initial food reformulation, given the comprehensive nature of the Chilean law. Researchers also expect that changes will be greater after implementation of phase 2 and phase 3 that are more stringent thresholds. Next, please. Also, national representative surveys show that a year after the implementation of the Chilean law, at least 30% of respondents declared choosing foods with fewer high symbols after comparing labels. In 2018, the percentage was of 58%, and in 2019, 72%. Also, evidence from Israel showed that 70% of participants declared their willingness to choose healthier alternatives after implementation of the policy. So with all these promising early results, what would be the potential effect on dietary intake and health? Next, please. So using simulation modeling methods, researchers in Mexico estimated that a mean calorie reduction of approximately 37 kilocalories per day could be achieved as a result of implementing mandatory front-of-pack labeling system. This reduction can seem minimal, but when estimating the potential effect on obesity, they found that this reduction could lead to a reduction of 1.3 million cases of obesity and a reduction of 1.8 billion in direct and indirect costs over 5 years. So reductions were only simulated in this study for snack foods and beverages. So it is expected a greater impact from this policy, given that the policy covers most packaged products and other food categories as well. Next, please. So studies from Canada show that the researchers used evidence from Chile and the meta-analysis that I previously showed regarding changes in consumer food and beverage purchases in the presence of a warning label. So using this data, they estimated the potential dietary and health impact of this policy. And what they found is that the policy has the potential to significantly reduce sodium, sugar, and saturated fat intakes among Canadian adults. And this in turn could avert or delay up to 8,900 diet-related NCD deaths. Next, please. Okay, so I'll finalize my presentation with this timeline of the adoption and implementation of mandatory front-of-pack labeling systems. The evidence and a strong support of the scientific community worldwide and advocacy efforts have led to the increasing adoption of this policy. And as of now, mostly in the Americas region. But many countries around the world are currently proposing these policies, such as India, Philippines, Indonesia, Central America countries, and Caribbean countries as well. Thank you for your attention.
These issues and cover that in the media. Next slide, please. Yeah, and again, the media sensitization continues for the pre-election strategy, and one-to-one sensitization meeting with the journalist across all the media centers are happening with support from our partners, with individual support and other places on that. So thank you so much, Nadia. It's back to you. Thanks.
Thank you so much, Sanjay, for sharing all the experience in India. And I was thinking as I hear you, like all the fronts that you have developed, because when this started, like talking about warning labels, seemed impossible. And now this discussion, even with all the obstacles and challenges that you're facing, is on the table. And how you have, worked and developed this kind of advocacy strategy with different fronts, like the FSSAI, like to leverage the elections as a political opportunity for FOPL, the Human Rights Commission, the consumer complaints. So this is like a very complex scenario in a huge country with a lot of cultural diversity as India. So yeah, congrats on that, because I think despite all the challenges that we are trying to address here, I think that all the organizations have done a great work. So now we will turn back to Luciana from FIC Argentina, who will share the experience of the advocacy experience of all the coalition here in Argentina, in my country, about how they passed one of the best laws that we have around the world on front of package warning labeling and other complementary food and nutrition policies. So back to you, Lu. Thanks.
Hi, hello everybody. Good morning, good evening. So, well, my name is Luciana. I work at FIC Argentina, which is an NGO that was here in the country for the promotion of policies to prevent NCDs. And I'm going to talk a little bit about the work that FIC Argentina has conducted, but not only FIC Argentina, but also a coalition of different organizations here in Argentina in order to promote the FOPL policy. Next slide, please. So the idea is to present the key policies of the Health Eating Promotion Law. That is the name of our legislation, which is quite comprehensive and includes not only front of package labeling, but also other policies. Next, I'm going to tell you a little bit about the highlights of our advocacy process, that it was quite complex and included, as in the case of India, different strategies. Also, now the law has already been implemented. So I'm going to talk a little bit about how it's working nowadays, the law in Argentina, and also the challenges that we are facing and how the industry behaved after the implementation of the law. And next slide, please. So, well, as I was saying, we are a coalition of different civil society organizations that includes organizations that have some common ground. Obviously, we all have in our mission the idea to promote policy that defend human rights and the right for healthy foods, but we are also different in different aspects. For example, FIC Argentina has different departments inside the organization, and one had to do with research. So we have a more policy-oriented research department, and that is one of our focus. Other organizations are only composed by nutritionists, and like FAGRAN, and other have a more environmental approach, like Consciente Colectivo. Other are based in other provinces of the country as FUNDEPs, and have more work on human rights and different dimensions of government issues. So we all form a coalition, and we all work together trying to work in coordination between all of us, making our voice heard, sometimes as a coalition and sometimes with our own particularities of each organizations. Next slide, please. So what does our law include? We have the FOPL component, which includes the octagons. These are all the octagons that we include that are similar to Mexico: excess in sugars, in total fat, in saturated fat, in sodium, and in calories. And we also include two precautory labels that had to do with highlighting the content of sweeteners and putting a label that said not recommended to children, and the same with caffeine. And it says it contains caffeine, avoid in children. And also we have these numbers that are included in those packages that are too small. And so when you see the number 2, that means to say that product has 2 octagons. We are also using the PAHO nutrient profile model. This was I think, one of the most controversial aspects of the law for the industry, and that was one of the things that the industry more criticized about the law, and also is more criticizing nowadays, even after the law has already been implemented. This is the standard of of the Pan American Health Nutritional Organization, and is the one that is more coherent with our nutritional guidelines, but also is the stricter one. So that is why the industry is so reluctant to the use of the PAHO nutrient profile system. The law passed on October 2021, but it had different phases for being implemented, and it has been gradually implemented, and nowadays it has already been fully implemented, at least in the front of package labeling component. Then we are, as I was saying before, this is a very comprehensive law, and we are not only including the front of package labeling, but also school environment regulation that includes the prohibition for advertising of products that include warning labels inside the schools, and also nutrition education at schools. Then we also are including, we have the strictest law regarding marketing regulations. Our law prohibits the use of different food advertising techniques targeted to children in all products that had an excess on critical nutrients. And we also are adopting a broad definition of what constitutes advertising directed at children and adolescents. And also advertising at the rest of the population is also strictly regulated and surpasses regional standards by limiting the inclusion of very attractive elements and celebrities defined as actors, actresses, musicians, and even influencers. So our law explicitly restricts all marketing in social media, and explicitly mentions influencers as a form of marketing technique. And finally, our law also includes a public procurement dimension that had to do with establishing that public procurement should prioritize products without octagons. So I'm going to mention some highlights about the advocacy process. Next slide, please. So as I was mentioned, this was a collaborative work, and I'm highlighting this because this is, I think, one of the strengths of our political process, the idea of working together, that working in coalition with different organizations, that being able to really work as a movement all together in order to include this problem in the agenda. Next slide, please. And well, I'm talking from FIC Argentina, but this presentation was developed in collaboration with all the organizations. So one of the things that was very important, Latin America has, Chile was the first country in our region, and thanks to Chile, we have a lot of different evidence that was developed, that was highlighting and was showing what was the best system to promote. So that was really helpful. All the evidence that was developed by PAHO and by WHO, and all the evidence that also Nadia mentioned at the beginning was really important in order to say that this was a policy based on evidence. And then there were some research developed here in our country showing that it was not only that was in general the best profile, but also for our own context. I mean, having these octagons and having the nutrient profile system from PAHO was the one that was the best from the Argentinian population. And there were studies conducted by FIC, but also from the Ministry of Health here in our country. Next slide, please. So what we did during all the process that had to do with advocating for the law, this was a very long process. I mean, this started more or less 2017 and ended in 2021 when the law was passed. So it was really like a very long process. And during that, I mean, we developed different actions for different audiences. We had the support of the Pan American Health Organization, and that was really important, and also from UNICEF, and also from other organizations that maybe were not part of this coalition of organizations that I mentioned before, but were really supporting all of us during all of our work. And here are some photographs of some of the things that we did, and one of that had to do with this campaign, this very big campaign in social media, and there where you see this phrase that is que no te tapen los ojos, that is to say not to have your eyes covered, with this woman having like her eyes covered with a lot of claims. So the idea was that now the industry was covering your eyes, so this law was going to help you to see what was the real content of the product. This campaign was adopted from one from Brazil, so that shows also the importance of collaboration between countries and how all the steps that other countries, all the advances in other countries also can help other regions and other countries to move forward. And this campaign, I think, was really important because, I mean, it helped us to get to a broader audience. I mean, it was not only all the specific audiences that each of organization had, but people who maybe were not really interested in nutrition or didn't have any idea about what front of packaging means. I mean, that started to be part of the general conversation. And this campaign had presence in out of home, in radio, in newspapers, and also in social media, and it was really, really huge. And also we conducted some the other photograph that you can see there with some young people and some teddy bears, and they are inside of the Congress of our country, and that was during one of our Child Day, when we were celebrating the Day of Childhood, and one of the organizations called Consciente Colectivo developed this action in the streets in order to show the relevance of protecting children and moving forward with this law. And well, also FAGRAN, this is the organization that reunites or that hang together all the nutrition schools from all over the country. And this was really important because they had really a very relevant voice in order to as an authorized spokesperson, as nutritionist, to say that we needed this law, this law was the best law that we could have. And then the other photograph, this light blue photograph, has to do with a campaign that we did after the law was implemented, and had to do with making citizens aware of the different non-compliance with the law that we were observing in the different supermarkets. Next slide, please. So this is Ana Cáceres. She's the president of PAGRAN. As the other organizations could not be here, the idea was I mean, they are in the present of this slide to say what they think about all the process. And she's the president of PAGRAN, this organization that includes all the nutritionist college of all the country, and she highlights the diversity of organization profiles and how this was very important in order to get the success. Next slide, please. This is Maga Mello. She's the health department coordinator from FUNDEPS, which is a very relevant organization that works on human rights in our country. And also she highlights the articulation and collaborative work between civil society organizations and this idea of having different actors and approaches that was really crucial for reaching the authorities and also the media. FUNDEPS and also FIC and different organizations use the human rights approach to analyze the law. And we also provide technical advice to a lot of the decision makers, considering different nutritional aspects, but also regarding legal advice and how should the law be written in order to make it very clear and to avoid future problems with the implementation of the law. And all this articulation and collaboration allow us to counter industry interfere and empower citizens. Next slide, please. This is Ignacio Porras, the executive director from SANAT. This is a very young organization, and they are mainly nutritionists, and their focus had to do with denouncing conflict of industry and food industry interference, and they had a lot of presence in social media. He also highlights the idea of collaboration between different organizations and the importance of working in solidarity with each other in order to gain greater outcomes. Then next slide, please. And Mijael, this is from Consciente Colectivo, and this is really, I think it's relevant because they are also a very young organization with a more environmental agenda, and it was quite important for us to get to work together with them because they have a different audience and also includes a broader perspective in our work, including all the environmental aspects regarding food policy. Next slide, please. Well, and this is me talking about the importance of collaboration. So some preliminary impacts about consumer behavior. I mean, we don't have, there are a lot of studies that are still in process, but something that are, I think, relevant to mention, and it's important to take into consideration in other countries, is that we had no baseline data information to accurately measure this. Still, the lost policy package is not fully implemented. I mean, school environments, I mean, this is still quite complex and it's still not fully implemented in our country. Yes, the front of package labeling. We didn't have in Argentina a very strong communication campaign as in other countries, for example, and in Chile. And in school environments and public procurement, there is no much information yet. And also the fact, something that it should be considered, that in Argentina we have a very high inflation. So prices of products and promotions are something that are quite difficult to change. But well, some preliminary studies, one conducted from the industry, showed in February, March, even when the law was still not fully implemented, that 33% modified purchasing decisions. Next slide, please. And one study conducted by the Ministry of Health it was an opinion poll conducted in all over the country, showed that half of the surveyed individuals are familiar with the law, with the name of the law. And when you show the octagons, 9 out of 10, when they see warning levels, they recognize that this had to do with the front of packaging law, but only 2 out of 10 know about marketing regulations. So that is to say that a lot of people, or most of the people, are completely aware of the octagons, but not of the other components of the law. Another point to highlight is that more than 80% agree that the labels allow them to easily identify healthy products. and almost 90% express agreements that labels enable informed choice about the food they buy and consume. It is important to say that this survey was conducted all over the country and also including people from different levels or diverse socioeconomic levels. And almost 50% of surveyed individuals expressed that they take into account the labels when deciding which products to purchase. Next slide, please. So what has the industry have been doing after the implementation? Well, the food industry encompasses multiple actors, not only big corporations, but obviously they are the most relevant actors in the field. And well, they develop different strategies to avoid compliance with the law. One that they develop, they require extensions to authorities. So that was why they implemented was delayed. Sometimes they put labels in the wrong size or locations. And also they develop different point of sale strategy that I'm going to show later. And we conducted a study to determine the level of compliance with the law in last August, and we saw that 100% of the establishments surveyed were found to be non-compliant with respect to the disposition of products, and 88% of the supermarkets found promotions associated with products. Next slide, please. So, and also we had some lawsuits and administrative complaints from PepsiCo, claiming basically that the product Gatorade should not be included in the law, and also with the Chamber of Industry of Meat, and also unfortunately those complaints did not proceed, and they favor the outcomes were in favor of FOPL. Next slide, please. And other industry behavior, I think I'm out of time, so I'm going to mention it very fast, but I can talk about this afterwards. It's, for example, that we see, as in other countries in the region, as Peru, for example, some reformulation efforts, and that they are now advertising some products without seals, like this one with the dinosaurs here. This also happening in other countries. Next slide, please. Then some point of sale strategies. This one is from Mexico, where you can see that they are using double fronts and not compliant with marketing restrictions on packagings, and the same happened in Argentina. Also, the use of promotion and discounts. Our law says that products with octagons cannot use promotions, and that we are seeing in a lot, in almost all the shops. You can see there still are promotions in products with octagons. Next slide, please. Then you can see that this one that was observed in Mexico, this idea of putting in the case of cylindrical containers, the containers in a way that you cannot see the front of package. Absolutely the same thing happened here in Argentina, when you can compare the fruit juice and the Coca-Cola. It's the same strategy. And also what happened in Mexico was that cartoon moved from the package to container boxes. Next slide, please. Okay.
Mamá, la cadena se salió y tú en la puerta, le dejo.
Then another thing that we are observing in our country is that we are observing reformulation. There is it's a study that it's still in process, but we are observing some products that are starting to reformulate, and the same happening in Mexico. And also what was observed in Mexico was increased digital marketing effort of products banned on package with warnings. Next slide, please. Well, this one, maybe then Rebecca can tell a little bit more about what's going on in Mexico, but this idea that reformulation would increase marketing strategies. Next slide, please. So what are we doing so far? Well, first, obviously monitoring industry behavior. we have not only what is going on in social media, but also what happens in regarding these legal complaints. And also Fundeps and FIC, in alliance with the consumer defense organization, we have filed 2 administrative complaints against Coca-Cola before the National Director of Consumer Defense, complaining about violations of front of labeling regulations. Because as you say, as you can say, there are a lot of challenges when advocating for the law, but also when implementing the law. And also we have denounced violations of advertising. Then we have also developed another, we have detected another non-compliance with regulations, and we made 2 other administrative complaints to Mondelez and also to Ferrero Argentina. And also we are working with the National Ombudsman Office in order to make a collaboration with them to monitor food advertising in television. Next slide, please. So, well, I am open to answer all the questions, and thank you for the time.
Thank you so much, Lu. Thank you so much. We really appreciate your presentation, and I think some things to highlight from the Argentine experiences, how these organizations with, of course, with common grounds of human rights, of NCDs, of public health, were able to target different audiences, were able to kind of leverage their networks, like each organization's network, in favor of the FOPL campaign, and also the decentralized work that has happened during the design of the law, and now in implementation, such as, for instance, the mass media campaigns, Not to Cover Your Eyes, that was seen all over the country, because sometimes these discussions, when we work in advocacy, are centralized in the capital cities of a country, and this was able to be all around Argentina. So now we will move to Rebecca, who will share also the great and tough process that Mexico went through to achieve this great technical standard that they have on front of package warning labeling. We saw some of the Mexican challenges in Lu presentations, but now we will dive into a bit more with Rebecca. So Rebecca, the floor is yours. Thanks.
Thank you very much. Good evening, good morning, good day to all of you. I'll be speaking on behalf of El Poder del Consumidor, which is a Mexican independent non-governmental organization. We're a consumer rights media advocacy organization that does public campaigning in the public interest. And here you can see one of the campaigns that we ran. I'll be talking a lot about, I hope that this goes along with the organizer's intentions, but just pulling out a bunch of different examples from the advocacy strategy and trying to give you some highlights and kind of some of the bare bones of this strategy. And there's just too much to talk about in 15 minutes. But you know, we've been working on this for 8 to 10 years now, and so there's a lot to say. So anyone who's interested in later and more information, please reach out. Next. So I want to talk today about Mexico's policy transition. We talk a lot about, in your countries, I'm sure as well, a nutrition transition, but we had a policy transition in Mexico to go from the GHAI label, which was proposed and self-adopted by the industry, particularly by the soda industry, starting around 2010, 2011, and then was adopted as an official policy in 2014. And so our challenge to be able to move to a front of package warning label meant that we needed to also defeat an already established and already implemented label across the country that had not only been used voluntarily by certain parts of the industry, but also there had been a mass media campaign that the industry had run in order to teach people how to read a front of package label, right? Isn't that ironic? But at the same time, to be able to push forward the industry's agenda of having an incomprehensible label be a national label for the public. And so this transition from 2014 to 2020 seems very short to come to a label that consists of, that was based on the Chilean system, that's endorsed by the Pan American Health Organization, UNICEF, and FAO. But it was developed and tested by a group of experts from over 30 different health institutions. And that was one of its biggest strengths. Next. So what did our advocacy strategy look like? Together with Mexican partners, and here I refer to a research partner, the National Institute of Public Health, a policy partner or lobbying partner, Polythink, as well as El Poder del Consumidor as a civil society partner. We were also working with other civil society organizations that I'll talk about on two different policy goals. We wanted to establish a front of package warning nutrition label based on PAHO WHO recommendations with high nutrition criteria. And we also wanted to ensure cross-cutting harmonized nutrition criteria for all of the other obesity and diabetes prevention measures that we were working on or had already established, such as fiscal policies, school food policy, etc. And so we were working across three different parallel tracks of action with each of the branches of government. So with the judicial track, we had two different objectives. We needed to achieve a legal precedent ruling the GDA unconstitutional, which would have given us a faster path to be able to establish warning labeling. But then also, after it was implemented, we needed to defend the front of package warning label. A legislative track to establish a legal framework and the higher overarching legal framework to have the highest law of the land, a general law or special legislation, which would create an obligation to have front of package warning label. And at the same time, an executive track, which you needed the secondary regulation of having a national regulation, or what in Mexico is called a standard. Next. And so we were asked specifically to talk about civil society roles and action to both promote and defend warning labeling in Mexico. There are too many examples to talk about, but I'll talk about the specific roles that we played in this period of time. Next, please. One of the biggest roles that civil society played was just to raise a strong collective critical voice. Here's a smattering, right, of the organizations that form a part of the Nutritional Health Alliance that began to be conformed in 2012 as a broad-based national multi-thematic coalition of civil society actors and networks and experts concerned about malnutrition, obesity, and diet-related disease. And what's interesting about this network, which has grown since 2012, is that it started out very diverse from the beginning, with organizations working on water rights, nutrition, development issues, children's rights, consumer rights, such as our organization, people concerned about chronic disease, producer and farmers networks concerned about food systems, and coming together with a rights-based approach and thematic expertise. And many of these organizations work specifically on front of package labeling, but not all of them do. But we have together a shared agenda. And this also allowed us to reach out to greater sectors of society when we were talking about the label. It also allowed us to reach out to a greater number of authorities and have a smattering of different types of spokespeople to be able to talk about the different importance of labels to their respective sectors and to give greater legitimacy to the cause. Next. But one of the most important lessons learned and one of the most important advocacy processes over the entire period of promoting the label and defending the label was engagement of broad support for front of package warning label in Mexico. And this was carried out not just by civil society. The legislative and the executive champions were critical in this. The academic community founded its own networks of experts and of health institutions that were signing onto the label. Here you have the National Ombudsman's Office, who created support, the Children's National Network under the government agencies, the Consumer Rights Agency, academia. And what was very important over the course of this was that international organizations also spoke out and defended and supported the warning label. And many of them also spoke out against the GDA, seeing the scientific evidence of its ineffectiveness and using that as a message also from within the country by national experts, but international experts also speaking to that cause, and many of them directly with the government, as we know that multilateral organizations like the WHO or like UNICEF or the FAO could do, which was very, very helpful. Next. What research did we do? A lot of our own research. It's true that we carried out opinion polling as civil society. It's true that we carried out some of our own kind of Vox Populi studies with people on the street, but we also really relied upon the dissemination of evidence and science and policy recommendations that were coming out from national experts. This obesity book that says Obesity Mexico there, I call it the Obesity Bible. It was produced by the National Institute of Public Health in around 2012 or 2013 and mentions all of the policy packages that could exist. The National Institute of Public Health also produced very important research. They did a study with university nutrition students in their first year of college, and which demonstrated that the GDA, the existing label that was applied, is not easily understood even by college students. So then, of course, how is it going to be able to be understood by the majority of the population? National experts at the National Institute of Public Health also produced studies on comparing what types of communities would be able to understand different types of options of labels. And then a comparative studies with 6 or 7 different types of labels, demonstrating that the most understandable label to the Mexican public were warning labels, and particularly for vulnerable populations. And those were things that we were citing continually. Our own population polling was very important because it demonstrated public lack of understanding of the current GDA label, and the very fact that the Mexican public couldn't understand or didn't have a previous knowledge of how many calories you consume a day. So how then could they understand a GDA label? And this was evidence that we used to be able to point it out to decision makers, but also with journalists and the general public. We called upon international recommendations, and the Chilean and Peru histories and stories were a test to success. And we carried out all different types of forums and videos and policy briefs, sharing the information from this experience, bringing the Chilean and the Peruvian experts and champions also to Mexico to be able to talk to their success. And that's very important with journalists, and it was very, very effective also with other decision makers who needed to be able to confront industry interference. And the champions themselves were then much greater inspired, being able to listen directly to fellow champions. Next. Another role that civil society actors played, together with the multi-stakeholder actors, was direct engagement with the authorities and the executive branch. There were steps for regulatory reform of the national health standard. And that meant that there was an actual advocacy process that needed to be carried out that followed the regulatory process in Mexico, as you have as well in India and the Philippines, that a development has to be proposed, a proposal has to be proposed by the government. Then a multi-stakeholder working group is conformed. I believe the dates here are wrong because that working group convened over almost a year-long period with government, academia, industry, consumers, and civil society organizations to discuss the proposal, to bring evidence to play, rights argumentation to play. It was very important to have UNICEF participating, for example, with in some of those discussions. And then there were public consultation processes for regulatory impact and a public commentary process where civil society, we were very engaged in getting people and particularly experts sending in commentaries to that process. Next. And then on the legislative track, we were doing all types of congressional engagement and social lobbying. We were trying to have this overarching legal framework to reform the general health law. And these two things were occurring at the same time. So a bill was being developed between 2018 and 2019. And it turns out that actually there were, I think at one point, up to 8 different bills that were being proposed by different champions. And some of those champions were actually opponents. They were proposing types like traffic light systems or systems that they thought would be better for Mexico. Some of them were fueled by the industry. Other of them were just kind of ignorant champions, not really understanding, what front of package labeling should look like. And one of the roles of civil society, together with some social lobbying organizations and some experts, were to actually pool those together and to be able to have a single bill competing in Congress, because there was no way that we could have several different bills being proposed at once. And so there was engagement, there was actor mapping, champion engagement, things that you all have been experiencing as well. A lot of advocacy engagement with the majority party, with leadership of all of the different parties, and confrontation of industry attempts to delay the voting in committees, to try to create obstacles to the initiative itself. But with the strength of the champion and the champions in Congress, we actually ended up having passage through committees, and successful voting both in lower house and in the Senate. And here you can see the champions with their wonderful t-shirts saying clear labels now, adapting and taking on civil society's theme, which was our theme from our mass media campaigns. Next. And we carried out a series of mass media campaigns that had messaging that went from calling upon the need for change in children's interest, demanding clear labels to be able to protect children. Then at the height of the debate, identifying the culprits, pointing to and unmasking the risk to health that comes. So our second mass media campaign was this one in the middle. At the height of the different debates, both in the legislative and the executive process, to say, here are the culprits, the products themselves. And of course, in the background, the industries that stand behind them. And then even after both the law and the standard were approved, we did a post-campaign to support implementation in the lack of a campaign on behalf of the government themselves, to point to the solutions. The solution of the labeling itself, to let it guide you in your purchasing decision, and the healthy products that you should opt for. Next. Well, or real food, right, that you should opt for. We won't have time to see this right now, but we also did a celebrity campaign where they learned, informed, and called for clear labels. And you all can receive this and look at the video later, where they went through learning about the products themselves, having emptied out into their hand the amount of sugar, the amount of salt, the amount of fat that were in a compilation of products that we had selected that were representative on the market. Next. And this is one of the campaigns then in one of the moments in support of reform of the general health law, to have people call for clear labels now with their photo. Public servants, the champions, civil society, celebrities came out on social media and participated in this call. And it was a very easy way to get the public to understand what this was and to create a sense of urgency. Next. We had a web platform and a campaign to facilitate participation in public commentary process, which was very important to be able to outweigh the amount of industry commentary that was coming in. Next. And throughout this entire process, I mean, starting back in 2017, 2015, 2011, we were combating industry disinformation and confronting industry interference. And here are just a few examples of that, including successful advocacy in the face of an attempt via the United States to include a clause in the NAFTA negotiations, a regional trade agreement, to say that individual countries could not create their own front of package warning label. And that ended up being defeated. But it's something that you all should be on the lookout as well. And we created a video series on industry myths. And we also created ways through requests for information to expose, to document and expose industry interference in the GDA formulation and defense. Next. On the judicial track, here I'm just mentioning examples after implementation of the front of package label. We've seen up to 150 writs or more of unconstitutionality filed by industry actors against the GDA. And at this point in time, 4 years after, well, 3 and something years after implementation, 6 cases are currently waiting to be resolved through sentences and ruling in the Supreme Court. And we've been carrying out hearings with the justices, letters of support from international organizations, UN rapporteurs, amicus curiae from global health community actors. Next. Even a WHO support that was thrown out through an award and a recognition that was given to the Mexican government, a tweet out at a time from Dr. Tedros in a moment that there was going to be possibly one of the votes in the Supreme Court next, which hasn't occurred yet. They keep pushing it back. Do you think industry might be involved in that? Next. And we created a repository of evidence and letters of support that are on the Clear Labels website. So the Clear Labels website also transformed over time to be serving the purpose and the advocacy purpose of the moment. And right now it has a huge repository of all of the evidence and the letters of support that are presented to the Supreme Court for the media to be able to access, for the public to access, for experts and advocates to access, and for the clerks of the court to be able to access, as well as presenting them physically. Next. Where's our progress? Well, on the legislative track, we were able to reform the general health law mandating front of package labeling. On the executive track, we have the modified national standard, and my colleague here spoke to many of the of the wonderful benefits of the Mexican label and the Argentinian label, which are very similar. And on the judicial track, we have a lot of ongoing processes. We've been able to effectively win a lot of arguments in public debate and expose industry interference. We've had successful requests for information and a foreign legal assistance case against Coca-Cola that gave us discovery documents that allowed us to file administrative complaints against public servants who were involved in the industry interference in determining the GDA as the formal front of package label in 2014. And those administrative claims are pending and could result in sanctions against those public officials. Next. And I'm wrapping up. What are some lessons learned? What are some of the most important challenges that we see for other countries in the future? And this is, with this I'll end. It's impossible to name them all. I mean, one of them is always improve on what came before. We learned that from Chile and from Peru. To be able to implement an additional, the additional seals, the additional precautionary legends on caffeine and on sweeteners. We hope that those serve other countries around the world to be able to use that evidence. We extensively studied, we and the researchers here, the studying and modeling of design in country, which was incredibly important. The parallel and harmonized legislative and regulatory reform was very important to be taking care of that all throughout the process, using really effective, simple messaging with the public, and then finding new ways to say that and come out with that, like using the celebrities at one point in time. The really diverse legal action starting in 2015 with our own cases against, we filed writs against the GDA and learned from that process. And we had to prepare along the way for all the false arguments that the industry was presenting, including these false arguments about codecs, about delays and they wouldn't be able to implement the label on time, or the free trade preempts. And we've learned a lot through this process and are really happy to share anything else that we can with you, because it helps us to mirror too and to listen to the challenge that you're facing. So thank you.
Thank you so much, Rebecca. That's like a lot of information. Trying to summarize all the things and the greatest strategies that's happening in Mexico. And I really like how do you outline like the different strategies in the different branches of government that are still ongoing, because we know that even if having like the best standard law or regulation pass, our work doesn't end there. And also I think it was also important to highlight how the public sector, like for instance, the National Institute of Public Health, and how everyone played a key role there. I really like that table that you summarized. And of course, like all the work that you highlight about the mass media campaigns in the different stages of the process. I think that's something that it's key from El Poder, and I suggest everyone to take a look and to do a search on YouTube to take a look at all the great resources from El Poder. And I also share the website that you share, because I even use it for my work to support other countries, like all the information that is in that website. So I hope colleagues from the Philippines and from India can take a look at those resources. So thank you so much, Rebecca. So last but not least, we will hear, I know that we may run a little bit over time, so I appreciate your understanding, but the thing is, like, there are a lot of things we want to share with you all, so that's why sometimes it takes more time. So now we will go to Milena Waldron from FIAN Colombia, who will share some of the experiences from Colombia in the advocacy process of having a front of package warning labeling regulation with many obstacles as well. And Milena will present in Spanish, so if you're not comfortable in Spanish, please go to the Spanish, to the English language, sorry, to hear Milena's presentation. Thank you so much.
Gracias. Buenos días, buenas tardes y buenas noches para todas y todos. Bueno, esta presentación, por supuesto, yo vengo de parte de una organización defensora de derechos humanos que trabaja por el derecho a la alimentación, que se llama FIAN Colombia, pero pues este ejercicio en Colombia, al igual como ya lo mencionaron en Argentina y en México, pues tiene detrás toda una coalición de organizaciones que, hemos hecho, digamos, un trabajo así muy mancomunado. Ahí está organizaciones que trabajan con mamás y papás para hacer mucha sensibilización en este grupo de población, Red Papás. Al inicio también estábamos acompañados por organizaciones de consumidores y hoy en día nos acompaña una organización que es icónica aquí en el país de toda la vida. Hemos crecido escuchando sus informes en el horario, digamos, principal de televisión del país, que es una organización que se llama Tal Cual. Tenemos organizaciones que hacen abogacía en derechos humanos también, un grupo de abogados y abogadas, un colectivo que se llama el GHAI, y también tenemos una organización que es un referente en todos los temas de jurisprudencia en el país que se llama de justicia, y por supuesto hemos tenido el apoyo que ha sido fundamental de GHAI en todo este proceso. Entonces, si quieren continuar con la siguiente slide, les agradezco. Bueno, la historia de nuestro país también está llena de muchos elementos como muy similares al recorrido que han hecho Argentina y México, sobre todo en esa arena del mundo legislativo y de la aprobación, digamos, por los congresos o nuestros representantes políticos de los gobiernos. Esta iniciativa de tener un etiquetado frontal de advertencia, pues eh, empezó con un primer proyecto de ley en el año 2017 que no tuvo el apoyo suficiente. Fue un proyecto que nuevamente se presentó en el año 2018. De nuevo, la industria en este caso armó todo un frente de parlamentarios o de políticos que son financiados. En nuestro país existe, digamos, una regulación muy flexible frente a la financiación que hacen sectores privados y cualquier tipo de industria a las campañas políticas y, por supuesto, estos llegan a ser representantes de que defienden intereses de la industria, entonces logran hundir acabar con el proyecto de ley que veníamos promoviendo desde la sociedad civil en 2018 y es hasta el tercer intento que hacemos en 2019, bueno, que se logra tener esta legislación que enmarcamos en la necesidad de una medida de salud pública para regular este tipo de productos comestibles y bebibles ultraprocesados. Esa ley, que es la ley 2120 del 2021, es una ley que su nombre técnico es de entornos alimentarios saludables, pero que era conocida coloquialmente y logramos posicionar esa narrativa en la opinión pública como la ley comida chatarra. Y hoy en día todavía digamos, se conoce coloquialmente así. Y el objetivo de esa ley, que es una ley que por supuesto aborda la regulación del etiquetado de advertencia en el país, pero es una ley que tiene un marco grande y es promover esos entornos alimentarios saludables y prevenir las enfermedades no transmisibles. Entonces, eso creemos que es una, digamos, una de las primeras formas en las que se ha logrado blindar esta iniciativa y efectivamente el artículo 5 específicamente habla del etiquetado frontal de advertencia y habla de esos productos que son comestibles o bebibles que se clasificarán de acuerdo al nivel de procesamiento y donde se usará evidencia científica libre de conflicto de interés. Esos dos elementos, haber logrado que la ley marco que protege nuestro sistema etiquetado hablara del nivel de procesamiento y que se estableciera que debía construirse ese sistema con evidencia libre de conflicto de interés, fueron tal vez dos de los aspectos más fundamentales y que nos costaron mucho más en nuestra batalla precisamente con los sectores de la industria y con los representantes políticos en el trámite de la ley, ¿sí? Y esta ley queda como el marco general y efectivamente necesita una reglamentación, es decir, una norma de un nivel mucho más específico que muestre cómo estará, cuáles serán los elementos de ese etiquetado frontal de advertencia. Y eso se logra también con, por supuesto, un ejercicio que mostraremos ahora de presión de la sociedad civil y la academia en este caso, con la resolución 2492 del año 2022. Esa es la regulación de esa ley marco del año 2021. Nosotros en Colombia tenemos que contarles que no tuvimos el apoyo en este proceso de la institucionalidad del Ministerio de Salud de ese momento. Era un ministerio que infortunadamente en esos gobiernos estaba muy asociado con los gremios y los sectores más poderosos de la industria en el país. Entonces, en esos espacios que se nos abrieron a la sociedad civil para participar de la construcción del sistema de etiquetado, estaba sentada la industria también al mismo nivel de cualquier otro actor, pero por supuesto sabíamos que el poder que ellos tenían de influencia era mucho mayor. Y en ese trámite de la ley, la industria logra que el ministerio emita una resolución, que hoy en día es una resolución que ya está abolida, pero que hizo mucho daño, y es la resolución 810, donde mostraba un etiquetado de forma circular, que les voy a presentar en una imagen posterior, pero efectivamente ese etiquetado que estaba diseñado a favor de la industria, pues logramos que fuera abolido y que esta resolución 2492 tuviera estas características y es la resolución que prima en este momento sobre las medidas de etiquetado en el país y aquí les cuento las características generales. Primero, es una resolución que habla de el exceso en unos nutrientes críticos, ¿sí? Que utiliza el perfil de nutrientes de la OPS y que hace referencia a la clasificación NOVA de alimentos para definir cuáles productos deben tener el etiquetado de advertencia y algo también muy importante para nosotros y es que no permite que en el mismo producto esté el etiquetado de advertencia y el uso de claims o estas frases positivas en salud y en nutrición. Ahí está la figura que se logró posicionar como una figura de advertencia, que es el octágono de fondo negro con la palabra exceso en, y los nutrientes críticos que se incluyen, está por supuesto el sodio, los azúcares, las grasas saturadas, las grasas trans, y se logra que esta resolución incluya la advertencia de los edulcorantes, que era algo que también, digamos, se había tratado de posicionar específicamente en el caso de este aditivo y pues no se había logrado en la regulación que promovió la industria y el Ministerio de Salud de la época. Y bueno, los límites, por supuesto, son los que tiene establecido el perfil de nutrientes de OPS. Esas, digamos, son las características técnicas generales de nuestro sistema etiquetado. La siguiente, por favor.
Niola, can you move the slide, please?
Bueno, ¿cuál fue esa estrategia de incidencia y movilización que nosotros consideramos que fue clave para hacerle frente a este panorama adverso que teníamos de la institucionalidad y la industria en un bloque para evitar que la medida, digamos, tuviera las características técnicas que se necesitaban? Nosotros organizamos una coalición entre la sociedad civil y la academia, y aquí es muy importante que era una academia libre o sin conflictos de interés. Y esto, como les comentaba, como quedó en el texto de la ley, fue un logro muy importante porque gran parte de los ataques y de la, digamos, la forma de entorpecer la toma de decisiones legislativas, en nuestro caso, venía precisamente por academia y producción de conocimiento pagado, financiado con intereses de la industria, que por supuesto le hacía mucho daño a las iniciativas. Entonces nosotros nos rodeamos de una academia que estaba libre de esos conflictos de interés, y ahí fue muy importante que los argumentos estuvieran basados en evidencia científica de esas características, y nos sirvió fundamentalmente para empezar a posicionar unas narrativas que tratamos de comunicar masivamente y de que fueran parte de nuestra incidencia y movilización. Y es posicionar la diferencia entre los alimentos y los productos ultraprocesados. Nosotros en español podemos hacer esa diferencia que entendemos que es un poco más difícil, por ejemplo, en el inglés. Y nosotros nos hemos encargado de que idiomáticamente, cuando hablamos de los alimentos que han evolucionado con nosotros y aquellos que transformamos de una manera respetuosa con su matriz alimentaria, los llamamos alimentos o alimentos reales, y a cualquier producto de estas características del ultraprocesamiento siempre nos referimos a ellos como productos comestibles o bebibles ultraprocesados. Eso era una cosa totalmente inadmisible para la industria. Ellos hablaban de alimentos ultraprocesados, y hoy en día hemos logrado avanzar tanto en posicionar esta narrativa de la diferencia fundamental entre un alimento y un ultraprocesado, que incluso la industria ya habla del ultraprocesamiento y tiene que referirse en esos términos a sus productos, así como la institucionalidad también habla de productos ultraprocesados, ¿sí? Nos encargamos de que hubiera una participación en espacios de debate público que tradicionalmente no estaban abiertos para la sociedad civil o para la academia, ¿sí? Espacios en el Congreso de la República, espacios en medios de comunicación de amplia difusión, y por supuesto que incluían las campañas comunicativas en las que nosotros estábamos tratando de generar una movilización de la sociedad civil alrededor de la necesidad del etiquetado. ¿Por qué era importante? Eh, ¿Qué tenía de fundamental tener unas etiquetas que nos advirtieran sobre esos nutrientes críticos? Entonces, esto se enfocó en la sensibilización a la sociedad civil del daño a la salud que está puesto en términos como organizaciones defensoras de derechos humanos, de la violación de derechos humanos. Entonces, nuestras campañas de comunicación masivas y nuestras campañas pedagógicas empezaban siempre poniendo de presente que este era un asunto o es un asunto de violaciones de derechos humanos a la información, a la salud y por supuesto a una alimentación adecuada. Y claro, fue fundamental hacer todo este ejercicio también de sensibilización, pues en esos espacios de decisión con actores políticos. Nosotros tenemos que reconocer que aquí en la experiencia colombiana, el fuerte de nuestra incidencia fue muy difícil lograr tener, digamos, un número considerable de esos actores políticos que estuvieran a favor de nuestras medidas, pues porque hay una gran captura corporativa, que así lo llamamos nosotros, de la industria, de muchos sectores, entre esos, por supuesto, los actores políticos. ¿Qué logramos? Como lo comentaba, que nuestra ley marco del etiquetado pues hable del nivel de procesamiento, posicionar el concepto de ultraprocesamiento en la agenda. Y algo muy importante, nosotros logramos que se posicionara el ultraprocesamiento más allá de los nutrientes críticos, ¿sí? Porque sabíamos ya de la experiencia de Chile que dejarlo solamente, o bueno, no dejarlo solamente, sino que la industria se protegiera solamente pensando en que era superar el nutriente crítico, pues era abrir paso a la reformulación. En nuestro caso, siempre hablamos del ultraprocesamiento e incluimos todo el universo de aditivos y el mismo proceso de diferentes niveles que lleva el ultraprocesamiento como un daño efectivamente a la salud y al derecho a la alimentación. Las decisiones deben basarse en evidencia libre de conflicto de interés y además posicionar, digamos, esa necesidad de defender una comunicación, nuestras estrategias de información y comunicación, como la necesidad de proteger los derechos humanos y esto como un asunto de derechos humanos. Los ataques de la industria específicamente en estos asuntos conceptuales estaban enfocados, por supuesto, a decir que el ultraprocesamiento era pseudociencia, ¿sí? Y esto fueron comunicaciones y conceptos técnicos emitidos, por supuesto, por una academia con conflicto de interés y que estaba financiado por actores la industria, actores políticos y el enfoque del nutricionismo, ¿sí? Que es pensar que es solamente un nutriente el responsable de los problemas que nos aquejan en alimentación y nutrición y que modificando ese nutriente o enfocándonos específicamente en cierta línea de productos, con eso, digamos, ya tenemos una solución. Nuestra mirada, por supuesto, intentaba ser mucho más integral de promover la necesidad de entender esto como un asunto de una mejor alimentación en general. La siguiente, por favor. Bueno, en cuanto a los aspectos de esa coalición que logramos conformar con la academia, que resultaron muy importantes para posicionar, digamos, estos elementos centrales que les acabo de comentar, nosotros consideramos que esa asociación con la academia ha sido uno de los aspectos más exitosos para hacerle frente a la interferencia de la industria. Nosotros logramos crear una red de académicos y académicas por el derecho humano a la alimentación y nutrición adecuadas, donde están académicas de diferentes campos del conocimiento de las principales universidades públicas y privadas del país, ¿sí? Esta necesidad de rodearnos de evidencia y de, digamos, los argumentos de académicos y académicas reconocidas por su ejercicio en favor del derecho a la alimentación, consideramos que es un factor clave, ¿sí? Que nos sirvió para, entre otras cosas, siempre tener conceptos y emitir documentos técnicos que contrarrestaran los ataques de la industria. Y por supuesto, teníamos el apoyo de aliados globales de la academia que también están trabajando, digamos, en este mismo horizonte y de toda la evidencia científica que afortunadamente cada vez es mayor sobre la necesidad de tener una medida como estas y además que se evidencia libre de conflicto de interés. Estos dos estudios fueron fundamentales aquí en Colombia. El primero, donde está una comparación de los diferentes tipos de forma que se usarían para el etiquetado frontal de advertencia. Y aquí en esa tabla quiero que se fijen en el círculo que está puesto ahí. Esa fue la forma de ese etiquetado fallido que el Ministerio de Salud pues estuvo promoviendo y que logró tener incluso como una resolución para, digamos, de la mano de la industria. Y en ese momento sale este estudio en donde participaron académicos y académicas de la red académica, donde se demuestra que la forma que logra es estimular en mayor medida la elección de un ultraprocesado es el octágono de fondo negro y el resultado es contundente y por supuesto esto en población colombiana pues nos daba muchos argumentos para defendernos frente a lo que estaba pasando. Y el segundo estudio que están viendo ahí es un estudio que hace también académicos de nuestra red que el gobierno, en ese momento el Ministerio de Salud dice, vamos a revisar toda la evidencia a nivel global sobre cuál sería la forma, el color y el texto y los nutrientes y los límites de nutrientes que mejor funcionan para un etiquetado y efectivamente ahí es donde la evidencia señala que sería el octágono de fondo negro y las características que ya les mostré. Si podemos pasar a la siguiente. Bueno, ¿y cuáles son esos factores que que ayudaron a que efectivamente la medida siguiera implementada a pesar de la interferencia de la industria. Pues nosotros consideramos que la presión de la sociedad civil y de esa academia en espacios técnicos y con una estrategia comunicativa fuerte, ¿sí? Siempre tratamos de posicionar la necesidad de que las autoridades de gobierno que tenían que llevar a cabo la implementación del etiquetado, pues debían cumplir con las funciones, las responsabilidades que tenían, y aquellas organizaciones encargadas de la monitoreo de cumplir esas funciones, pues también hicimos siempre una fuerte presión. La movilización social en el sentido de que este logro en nuestro país de tener el etiquetado, pues es un logro del esfuerzo de la sociedad civil y la academia, ¿sí? Y la necesidad de que siempre la academia que acompañe estas iniciativas, pues, esté, digamos, libre del conflicto de interés. Y las recomendaciones para elaborar una política que efectivamente sea sólida y menos vulnerable a la interferencia de la industria. Nuevamente, el apoyo de la academia, apoyado, por supuesto, en esta evidencia libre de conflicto de interés, que el marco de la política esté puesto en términos de la promoción de una alimentación saludable y como una medida de salud pública. Nosotros recomendamos sistemáticamente denunciar la interferencia y la captura y exponer todas estas estrategias de la industria. Creemos que eso es muy efectivo para desenmascarar, digamos, toda la serie de estrategias que utilizan. Y algo muy importante que hemos aprendido también de la etapa de implementación en que estamos en Colombia es que es muy importante que también las autoridades de gobierno implementen estrategias masivas de pedagogía y, por supuesto, desde nuestra parte también acompañar esos ejercicios. Entonces, creo que con esta ya finalizo. No sé si había otra diapositiva al final. Creo que no. Bueno, les agradezco mucho su tiempo y bueno, estaremos muy atentos aquí también para apoyarles en lo que se necesite.
Thank you, everyone. Thank you, Milena. That was wonderful. Miola, can you please stop sharing the, that will be wonderful. If I can have, well, first of all, thank you for your presentation. This is gold information, and I hope this helps the campaign in India and the Philippines. Please feel free to reach out if you have any questions or you want to follow up. We're going to share the recording of this webinar and also some other materials. So this is amazing. We're 24 people. May I ask, please, whoever can share their screen so we can take a group pic before we end the session. That will be wonderful. Thank you. Thank you, everyone. I can see most of them. Thank you. They say cheese. And I'll share this with everyone too. Before we end up, I just have a couple of questions for presenters. I'm sorry, this is not working for me. Okay. Here it is. So we received questions from participants before, and we would love to hear. So how industry reacted to the advocacy efforts, and what was the opposition? I think you guys presented this in your talks, but can you please elaborate how what were the tactics that you used from the advocacy piece to counteract these industry arguments, especially with the nutrient profile model? Thank you. Lu, gracias.
Thanks, Nadia, for the question. Well, in Argentina, we developed different actions to counteract food industry. In the case of PIC, we developed 2 documents that were like arguments and counter arguments, and based on what industry was saying, mainly on newspapers and on social media, we then confront those arguments with scientific evidence. And like, I mean, it's like you have to, I mean, be really careful about when to do these arguments and counter arguments, because sometimes you're like giving the answer to the industry, to their arguments. But in this case, they were really public, and they were saying all the time all these arguments in newspapers. And so for us, we consider it was useful to provide decision makers, because this was in the time when the law was being discussed at the Congress, to provide decision makers with the evidence, say that those arguments were misleading and were incorrect, and all the evidence backing the nutrient profile system and the black octagons, etc. And also other organizations that maybe had more this profile of denouncing food industry interference all the time. I mean, they made a lot of things in social media and exposing conflict of interest and exposing food industry interference at the Congress. And for example, they were saying like excess of lobby, when sometimes we heard that Coca-Cola was meeting with different decision makers. So, I mean, a lot of different strategies with different voices.
Thanks so much, Lou. That complements the presentations too. And if you will have to choose, like this was, the moment that actually changed the course of things in your countries. It was a research, it was, a strategic meeting. What was that actually you think, this actually changed, and stakeholders and especially decision makers took the lead and changed this for the good?
Is that for all of us, the question?
Rebecca, sorry.
Yeah.
If you want to go ahead, please. Thank
Sure.
you.
I'll just add on to your last question. I mentioned that one of the strategies that we use to respond to the industry was sometimes that we would do like public actions, like on the streets, like a media action or a public event. And so we did one, for example, in front of the office of the Secretary of, I guess it's the office, it's like the FDA, it's the Federal Sanitary Authority. And then when we do those public actions, we would also use them specifically to talk about both government interference or conflict of interest within that government agency, but also how the industry was manipulating. And so those public events were also really a great opportunity. And I think on several occasions, we also put out full-page newspaper ads. And we did that video series on the 10 different myths about clear labels and front of package warning labeling. And in each of those cases of those 10 different myths, it was industry arguments that they were saying versus the truth. And referred to the same idea that you should, open your eyes and see the truth about this. I think 2 or 3 very, very critical moments throughout the advocacy process were supported by moments in which the World Health Organization, or through the Pan American Health Organization here in the region, or the World Health Organization, together with together with UNICEF, together with FAO, came out publicly or also wrote private letters to the Mexican government that at certain times then all of a sudden ended up being revealed. It was very important that all of a sudden you had the Mexican government saying, oh, no, but we're doing the right thing because we have this label and it's been implemented and it's nationwide, when they were defending the GDA. And then you had all of a sudden not only 30 different health institutes and institutions and research centers saying, actually, we need a warning label. And then international actors coming out publicly with statements saying, the Mexican government needs to do the right thing. And one of those moments was a moment in which the Mexican government was using a sugar criteria for the GDA label that was actually contrary to the WHO recommendation. And the WHO had not come out publicly about that, but then their letter ended up being revealed. And it was a very important moment because for the media, it created a lot of public debate when they're saying, wait, it's like the government's lying to us here. You know, this is not what's really happening, and they're not following the international recommendations. This looks like there's, you know, let's not say a conspiracy, but they're obviously following public interest, I mean, private interest rather than public interest. And so the combination of those moments of weighing in from international actors has been really, really critical.
Thanks so much, Rebecca. Yeah, I think that's most of the experience with other countries as well. It's you know, the research that back up these policies and key stakeholders, right? Especially international organizations that can openly talk about this and support the best practices and evidence. I just want to thank you again. I don't think we totally ran out of time, and thank you to all the participants for staying until now. Yeah, we'll send the information, and I hope you have all have a good day. Thank you.